All right, hey everybody. So we are going to do our spinal mobility or spinal hygiene exercises. So we're going to go through about 8 exercises total. There's a couple variations as to how we recommend you do them. Again, anything that you go through, if you're dealing with pain while you're doing it, I do not want you to be doing that. Please bring those questions into the office. Let me know what you're struggling with, and we'll work on that together, okay? But assuming that all is well, this is how I'd like you to go through the spinal hygiene or spinal mobility program. Most of it is going to be performed on the floor, so we'll get that angle there. And the first one is always our favorite one that everybody should be doing every single day. It's very similar to our wobble exercise we teach everybody, but it's going to be our cat camel or cat cow is kind of how I always taught it. But all we're going to be doing is getting into a quadruped, or really on our hands and knees, and we are going to be getting into that cat position, or I'm going to think about tucking my pelvis underneath my hips. So that's that motion, tucking my core, using my core, and I'm letting my thoracic spine round as much as I can. I'm pushing with my arms into the ground, and I'm going to tuck my chin. And the contrary, I'm going to go opposite where my head comes all the way up. I'm going to let my belly fall all the way down to get extension in my low back. I'm going to let my shoulders fall, and I'm going to extend my thoracic spine, lift my head all the way up. So that would be 1 rep that we'd want to do that for. So down and up, that'd be 2, down and up, and that would be 3. It's a very slow movement. Notice how I'm not just throwing my low back out forward and backwards. It's going to be controlled and comfortable, making sure we get good movement on the low back. The next one is in that same position. It is called the bird dog. And all we're going to be doing, it's really good for the brain actually when we use opposite arm and opposite leg. We're going to be going away, out in this direction, and back. Out in this direction, left arm with my right leg, and back down. That would be 1 rep of that. We're going to go here, right arm, left leg, left arm, right leg. And you might notice that when I get there, I'm not just going to throw it back really quickly. I kind of want to hold for a moment, control it, and then we'll bring it back. All right, so those are the first 2. The next one that we're going to get into is in the very similar position. It is called thread the needle. It's going to be really good for the mobility of our mid-back, our thoracic spine. And with these 2, this thread the needle and the Caesar pose, I like to do those together. You don't have to, but I think it makes more sense. I'm going to come through, nice breath in, and the next exercise actually lifts up into here. So I'm just going to come all the way back. Take a deep breath into my rib cage. If you're on this right side, you'll be able to see. I'll do it the other way too. I'm going to come back to the right, open up my thoracic spine. Deep breath in. I'll come back, and I'm just going to lift this direction, breathing expansively into my ribs. And as I do more and more reps of that, I should ultimately be able to get deeper and more mobility, more range of motion. The next one that we are going to do, how does that work? We're going to get into this position here. We're going to rotate. I'm not doing anything with force at the end range. I'm not trying to make anything pop. I'm not trying to make anything move. I'm just going to get to the end, push a little bit further, and I'm going to take deep breath in. Let it go. I should be able to get a little bit further. Deep breath in, a little bit further. And I believe this one we're going to hold for about 30 seconds for each way. And come back the other direction. Very simple. All right. Next one is a seated thigh stretch. Most people, when they perform this, it turns into a very bad posture in terms of the position we get into, very rounded. Whereas I really want to try and extend my low back a bit and get my chest up and start driving it forward over my toes. I'm almost kind of pulling my heels towards me or my feet towards me. And I want to feel it just in my groin muscles, in the big adductor muscle group. I shouldn't be feeling this in my low back, shouldn't be feeling it in my hamstrings or glutes. It is all about the inner thigh, inner leg muscles. All right, and the next one that we're gonna do, Second to last is just our kneeling hip mobility. And the reason I like this one so much is I'm just gonna get on one knee and have my hand, I'll do the other side, it'll be easier to see. My hand kind of where my hip joint meets my pelvis. And I'm just going to be rocking around. I will go counterclockwise, doesn't matter which way you want to start, and I'll go clockwise. I'm not looking for much pain or discomfort. I want to give therapeutic input to this hip joint so that all the muscles that connect to it are not overly tight for no reason. If I can remind my brain that this joint is actually okay, healthy, moving well, then all the muscles that surround that joint aren't going to pull abnormally hard, which will be better for you. The last one, I'll stand up here, just our Brugger's postural exercise, which I've probably taught some of you, but we're going to go through it again. So all we do here, arms are going to come out in front of us. I always want the elbow in front of our lat, kind of on our rib cage. I don't want it back here, okay? So always a little bit more forward than you think. Like you're holding a tray, hands open. We are externally rotating to engage all the muscles of the backside of our shoulders. If we sit like this all day, I want to do opposite on a pretty regular basis. The thing about this that most people do differently is they want to get a big retraction of the scapulas, and I don't want to do that as much. I want to externally rotate hard. It will open the chest a bit, but I'm not going to do all this. So that's the key movement. I'm not going to move my elbow back behind my rib cage. I want to keep that here the whole way. Once I end up in this position, lift the chin up just back a bit, and I'm going to breathe in the front of my chest. There's a couple ways you could do this. You could do this in repetitions. I can come back, good, 2, but I like to do it a little bit slower, where I'll go and I'll come back this direction, lift my head up a bit. I'm holding tension in these shoulder muscles, and I'm just going to take about 3 or 4 breaths, just comfortable in this spot. And then I might do 2 or 3 reps of that, but you're not going to do 10 reps of holding this position for 2 or 3 breaths, because that's going to take way too long. So pick one or the other, try it out, and let me know how it goes. The goal is to turn this into a nice little flow. It should take you about maybe 5 to 10 minutes just to warm yourself up, get moving, make sure your spine stays moving. Because again, if you see the sign in our office, 90% of the stimulation and nutrition to the brain comes from movement of the spine, and that's what this is going to do for you.